we will talk about your gut. Yeah. So not just skin deep, right?
Yes.
So your gut is involved in everything, as we know. So, all right, serotonin. Quiz again, Dr. Natalia. Where is the majority of your serotonin created or produced?
Pituitary.
Right, that was a trick question, Dr. Natalia. But
was that
points.
Wrong?
It's the gut.
Oh God. my dad's gonna be so disappointed that I didn't know the answer to that. It's in your gut. Okay, yeah, I did.
Right,
know.
And the reason that I mentioned that is because people think, well, it's all up here.
Yeah,
it's all up here. Just sort this out, and I don't know.
Yeah.
But the gut is involved in your production of hormones and the recycling of hormones. Mm-hmm. So if you've got a dodgy gut, or if you've got a term that we like to use in medicine only for the last 10, 15 years of leaky gut, where you've got lots of inflammatory problems, what's the word? Microbiome. Autoimmune.
Oh, autoimmune.
Autoimmune.
Yes.
You're going to be a bit more inflamed. And that actually affects your ability to recycle estrogen. It affects your ability to produce these lovely neurotransmitters like serotonin. So we need to look at all of that.
Okay.
And with that can even be like, right, let's look at how we can reduce your Deliveroo consumption. Or let's look at how...
I was like, did you say Deliveroo?
Okay. Sorry, I'm not allowed to takeaway. Your takeaway. People here, again, the way that I see it here in many places, we are very time poor. So getting a salad from a takeaway, am I allowed to say takeaway?
Yeah, you can say Deliveroo.
Deliveroo. Love you, Deliveroo.
I use Deliveroo myself.
Yeah, I love you, Deliveroo.
I love you too.
For patients, we don't know what's going into these foods. So even though, I eat Whole Foods, I eat cheesies, it's like, great, but let's look at what you're eating.
Yeah.
And that's what I mean. It takes time and it takes commitment. There are some people like, just give me a med and I want to be out of here. And we're able to develop that trust, that rapport, saying, yeah, I can do that. That takes me 3 seconds. That's not going to help you.
No.
Looking at sleep. So I think I'm really guilty. And because I'm very honest with my patients, I'm like, listen, I can relate. I'm up at 3 o'clock in the morning, sort of, I don't know, shopping for stuff or looking at cute dog videos or looking at children jumping off things, and it's like, You've Been Framed videos. Do you remember You've Been Framed?
Yes.
Yeah,
those are fun. Yeah.
It's fun. But it's not useful because that's going to increase your cortisol, which is your stress hormone, which then has an impact on your dopamine again, and da. And it's not just saying it is ADHD or it's not. It's like, these are the symptoms that you've got. These are all related. Let's look at how we can, first of all, get you to minimize them yourself, if that's what you can do and what you want. Some people can't. Me telling you to go and sprint every day for like 3 hours, it's like, well, I don't have the time.
So the inclination.
Or the inclination. But do you know what I mean? So it's about what you can do, making it practical, making it reasonable. And if you're like, Doc, I don't have any time, then we're going to try and find you time.
Yeah.
And that's why there needs to be a therapeutic relationship and partnership, not just with your therapist or your Reiki healer or your
sound bath.
I do love a sound bath.
I've never had a sound bath, so I have to.
I will take you to a sound bath.
Things to do.
Yes. So I'm going to make some time. We're going to go to a sound bath.
We're going to make some time. That's when they hit the thing. There's no bath involved.
There's no bath involved. Okay. We can do it in a bath if you like, Dr. Natalia. I don't mind. Quite happy in my professional capacity. But we look at the micro changes that we can make.
Yeah.
There's no point me saying, right, we've got to do this plan. We wait for your bloods to come back. And then I'd say, look, let's go and see if you want to do your hormone stuff with me, we can do it. Or I've got a great doctor who I've referred to in the past. Let's go and see them. And let's really get this multidisciplinary team in play. And I talk to my colleagues. I'm like, hey, you saw my patient. What do you think?
Yeah.
Because there's no point you having a conversation over there and me having a conversation over here and then we not talking about the same person. Right.
That doesn't happen a lot here.
No, it doesn't.
It doesn't. I'm trying to cultivate that within my own kind of doctor group.
Absolutely.
Where I send a letter and I say, thank you for referring your patient. These are the findings. And then kind of let me know if there's a change. But it's not a common thing.
It's really not. And it's so frustrating.
And it's so frustrating.
Right. For the doctor.
Yeah.
But also for the patient.
Yeah.
Because if you imagine, right, you've got executive dysfunction, meaning you find it difficult to keep appointments, to remember what someone just said to you 3 minutes ago. And then you come and see me and say, so what did they say? I don't know. Right?
Yeah.
So it's really important for me, like you, I will give someone a call and say, hey, what do you think? And I will let the patient know, like, by the way, you're okay with this.
Oh, yeah, we have to ask consent, obviously. Yeah,
obviously the consent. So, in essence, it is a multifaceted problem, perimenopause anyway. Add the layer of ADHD or anxiety, depression, whatever. It's an issue that we really got to get on top of. And that means you're going to have a multifaceted approach, the mind, body, soul, spirit. So sound bath, jokes aside, I love a good sound bath.
We're going to do a next podcast having a sound bath.
We're going to have a sound bath, and it's
for like 30 minutes.
Like an hour. What?
Oh, it's an hour?
You're shortchanging me.
We're gonna film it, guys. An hour of a sound bath. Isn't it just like lying there listening to like things dinging? No, I have no idea what I'm talking about.
I'm gonna rein that bit in before we offend all our healers.
Edit that all out.
And it's wonderful. It really is wonderful.
Okay, fine. Yes.
And it's and this is what I mean about the mind, body, soul, spirit. And I think as doctors, we have been trained we grew up in a particular way.
Yes.
Then we were trained in a particular way, which was at a time where I believe that medicine was changing. So we were learning. I don't think we learned about the gut microbiome at university. I don't think I did.
I think so. Ours was big on communication, which was the big change.
Yeah, that was the big change. So now we know how to talk to our patients.
We know how to talk to our patients, unlike doctors from like apparently 50 years ago who didn't have that training. So I'm like, well, okay. So we know how to talk to our patients.
Absolutely.
Yeah.
But there's the idea that your mind and the interplay between your gut and your mind and how your mind affects your gut and all of that is still coming through. So I think as medics, we need to learn a little bit more about it.
Yeah.
So our patients realise that they can talk to us about that. And then I'm not suggesting you start giving everyone a sound healing bath while they're in the waiting room, but these things do help. Movement helps. Embodiment, there's a lot of embodiment work that is out there. I can't vouch for everybody, but
what's embodiment work?
So it's basically where I know. What does that mean?
Yeah, what does that mean?
It's a chat
GPT.
It's where you're using movement and gentle movement to kind of reset yourself. That's how I would see it.
Okay.
All your embodiment therapists are probably going to want to kill me for saying that, but that's how I would frame it. So I'll be honest, I was always a go hard or go home kind of person. Lift weights, run, CrossFit. And
I might fit that description.
And
maybe.
Right. Maybe. With your extracurricular
activities. Yeah.
And it was really interesting. Like I then spoke to someone. I was like, I wake up at 6 and I do this before the kids wake up and I do it. And I'm like, grr. I'm still feeling really edgy all the time. They're like, well, maybe it's not working for you. Maybe you need to be a bit more. I was like, what?
Yeah.
If I can't feel it, I'm not going to do it. They're like, maybe you should try some yoga. I'm like, yeah, I tried that. My parents were really into it. It didn't really work for me. Yeah, and then I what am I doing? I'm let's try it again. Like stupidity is doing the same thing over and over and not getting a result, right? So I'm like, I changed it. And I was living opposite a beach. I was living in JB at the time. So it's like ground, take your shoes off and ground. I'm like, what is this? And I started doing it.
Right.
And it worked.
Right.
Okay. So I'm not saying all or nothing. I'm saying just keep an open mind. The things that can come out of, it's Mickey Mouse, or it's got grounding in thousands and thousands and thousands of years of practice. I'm not going to say if you don't want to believe the because there's not an evidence-based paper written about it, let's just say practice. And there is a happy medium where you can do your grrr, but you can also do your sound bath and your sound healing, but you've got to find something that works for you.
Yes.
I took a lovely friend, if you're listening, Amy, I'm really sorry, to a sound bath, to sound healing. I'm like, right, okay, let's go. And poor girl, I've taken her twice. So the first time she's like, I really didn't like it. Like it just felt like it was in my head. And then I'm like, oh, no. Like, let's do it again. And I took her to another one. She's just like, really wanted to leave 10 minutes in.
Good on her for going back again, though.
She did. And
that's good. It's open-minded.
I love that.
Yeah.
And the funny thing is, she's been even offered a free session with someone. I went on a flotation sound healing, and she was like, I'll do it free for you, friend, because I want her to change her mind. I'm like, she's not going to come.
Yes, there's no point.
Yeah, please. Don't give your space to someone else. The point is, it has to work for you. What works for me may not work for you and vice versa. Right. But give it a whirl.
Yeah.
Because if you're doing things and it's not working for you, just try
something
something
else.
new. And if you don't know where to try, well, Instagram's great now. I don't know if it is. Like sometimes people have all these wild promises, and I think talk to a friend. Friendly recommendations often work.
Are better, maybe. In some ways.
But massage can really help.
Yeah.
And yoga, Pilates, Reiki. It sounds like a lot of work. Like the thought of me getting on a reformer 6 months ago, like, no, it's just
hard.
not me. It's what are you? You're saying it's hard. What are you talking about?
Reformer Pilates is hard work. It's like very different from what I normally do. So I'm like, I can't do this. Like little pings like this. I'm like, no, my deltoids are on fire because it's a really different movement.
But
than
also
what I'm doing,
and it's the breathing.
Oh, yes, it's the breathing, but yes,
and it's the intention. And I think it's looking at exercise in a different way, right? So there is nothing right about 100% right about anything. There's nothing 100% wrong with anything, but really making time for yourself. And I can lose people at some point. They're like, "Dog, where have I got time?" I'm like, that 3:00 in the morning when you start scrolling on your phone. I said, instead of scrolling on your phone, you can even scroll on your phone. I want you to take a bath. You're looking at me like, you what? Yeah, I want you to run a bath. When you run a bath and get into that water and see what that does and how quickly you're able to go to sleep. And guys, like I'm not just saying this. Like I've been practicing medicine for a very long time, and I am a consultant of family medicine. So I've done, the training in the UK. You do your hospital medicine. We're in hospitals doing everything for like
Night
3.5, 4 years.
Day shifts,
night shifts, followed by a day shift and a 24-hour shift, whatever. We've done it. We've seen it. And the recommendations are from obviously my time in hospital medicine, my time in family practice, both here and in the UK, and realizing we're not getting it right all the time.
No.
And we are, and with life changing as it is, it's so fast. We're on all the time. I'm sure you see this, Dr. Natalia. People are like they've got messages coming on their phone, their phone in the pocket, the computer's on, and they're watching TV and having a conversation.
Well, I had a patient come in. She was on a work Zoom call, during her conversation with me, and she came for Botox. And she basically was on the call the whole time. And I did her Botox while she was on the Zoom call.
Right.
And like, we had this like whispered, like, can you sign the consent form? She's like, and the whole thing was like, she's like, I have to listen. I'm like, okay. So I was there doing her Botox and she was on the Zoom call. I'm like, okay, this is like, it takes about 10 minutes to do some of this Botox. I'm like, she couldn't reschedule the meeting. She had to be on that call. And I was like, and I get it. And that's totally fine. And patients do that all the time. But I have a lot of women come in, like they're doing like 10 things. They have the 2 kids, the iPad, then they have the call. Yeah. And then they have the thing is beeping and like, oh, I haven't enough steps. Like, it's just like,
right.
All at once. Yeah.
So just generally, that's exhausting.
It's exhausting.
And think about like the way that I've reframed that. And then, right, so genuinely it's exhausting. Then you add, going back to our ADHD or just perimenopause, right? Yeah. For any woman that is losing that scaffolding, like I call it, it's a nightmare.
Yeah, it's a nightmare.
And the way that I say it, so I've had people crying, be like, well, my mum did it. My mum had the job. My mum had the full-time job with the kids. And I'm like, okay, so did mine, but it was very different. The expectation was when you got home at 5:00, it was tools down. You weren't getting someone calling you at 7:00.
You didn't have mobile phones.
Yeah,
there was no iPhone.
There was no phone. And even when I was at uni, I remember like the internet was, if I was on the internet on MSN Messenger, my dad would go mental because no one could get onto home phones, right? It was one or the other. Now it
was a different time.
It's everything. So do you see what I mean? Yeah. The cognitive load was definitely there, but it was less. The way that I see it is like if you look, I don't want to show you my computer. It's just tabs. It's just 101 tabs.
Oh, I have that too. Yeah.
Right? Open. But that is a reflection. The way that I sell it I say to my patients, like, that's what's going on in your brain. So you've got all these tabs open when your mum or your grandma or my great-great-grandma in her time, she might have had like 3 tabs. It's kids, work, maybe, cooking. Okay, everyone's asleep. There were different stresses. Now it's like you've got parents getting older in your, maybe especially for expats, right, in your home country. It's you've got kids who have to be in 1,000 different extracurricular activities apparently because otherwise
they won't get into university.
They won't get into uni, and
they're 7 years old.
Yeah. Oh, no, I've seen less. I've seen young. Okay. Like, do they teach Mandarin? I was like, kids 4. Relax. It's okay. Let's play with Lego. Or whatever choice of toy that you want to play with. doctor's appointments, meeting up with friends, the school WhatsApp group, the Pilates WhatsApp group, making sure that you know that you're getting your protein intake and your collagen and your Botox and your whatever.
Yeah, whatever. Who gets home at 5, by the way?
Sorry?
Who gets home at 5 o'clock?
Exactly.
Like, nobody. Yeah, that's when the traffic is just starting.
It hasn't even started yet because no one's on the road.
I don't really know because I never leave work, so I have no idea. So 7 o'clock is peak traffic time. Yeah.
So we have opportunities greater than anybody before us. We have technology that should make our life easier, but it doesn't.
No.
And it almost makes us question ourselves even more. We're a society now where we're lonelier than we've ever been before. It's all so people can't actually talk to their neighbor or their friend. It's like, talk to someone on the bus or on the metro, or no, God no. And you just see people in the lift, they're just on their phone. So we're just on all the time.
Yeah.
So how on earth are we supposed to not feel overwhelmed? So I've spoken a lot. And I'm sorry about that.
No,
but I think, it's, and I'm merging multiple topics, and that's because just like medicine, it's not clear cut.
No.
Right? It's all grey. And you've got to take the time, if you're suffering, to sort of get through that grey and find out where on earth you're supposed to be. And it might not be clear cut even from the expert.
No.
Okay. And that's okay, but at least we've started that journey.
And I tend to say to patients who come in who have the feeling of being really overwhelmed and so much stuff is happening, and that happens, to me, even though people think I just look at rashes. I'm like, well, no, people come, the whole picture.
Yeah.
And I always tend to say, give yourself some grace, because you have to remember how much has happened. And because people come with stress-related skin problems all the time, or, stress-related, that's a diagnosis of exclusion, really. So I get to the stress-related if I can't figure out another reason why someone's having something. And I'm just like, well, they're like, yeah, but I haven't been that stressed. I'm like, well, let's look at what's happened in the past, few months. Like,
exactly.
There's been conflicts, there's been kids out of school, even just recently, there's been so much happening. So you have to give yourself grace with this, that yes, you can be affected by it, and this is how it's showing up in you.
Exactly.
And you just have to accept that and be like, yes, okay, I need to take a sound bath. Take a step back.
I'm going to take you to sound bath on Friday.
Sound bath on Friday. All right, I'll do that after I cancel my clinic to make time for it. No, but I think so. One thing I would say is if there's someone watching this and they're in this age group, 40-something female, and they're like, yes, I relate to a lot of that. I just don't know where to start. I'm not on HRT. I'm worried about perimenopausal. Do I have ADHD? I have all these feelings. The first, or these symptoms. What is their first step?
First step. Okay, so hopefully they have a trusted general physician, and I'm not trying to plug my specialty.
Yourself.
Myself.
Someone like Dr. Kiren.
Someone like me. No. A doctor that will focus on that mind, body, soul. And that they tend to be family.
They tend to be family medicine.
Family medicine, because we have to, right? Because we know their family, and we know them, and we know what they've been through. But get someone who will start from that and then move into the different. So it could be stress. It could be there's been a crisis and it's reactive. It could be that you're iron deficient or your thyroid is a bit off. So we need to go to a generalist. That would be my recommendation.
And that would be my recommendation as well.
Agree?
Not a gynae, not a psychologist.
No.
Not a menopause specialist doctor. I'm like, no, family medicine. Like, my favorite question is, do you have a GP?
And how many people say yes?
And they're like, no.
Yeah, exactly.
All right, I'll recommend some. These are the ones you see. But yes, I always say, because that's your role, is to look at everything.
And then
refer.
Almost.
There's a referral needed.
Exactly. Yeah. So it's, we people are like, you don't specialize in anything. It's like, well, we kind of do. We're kind of looking at you 360, and then we'll send you to the right person, because you might not be in perimenopause, and it might be that you are depressed. If the OBGYN says, no, actually you're fine, then you might be like, all right, well, we're good. And then you're suffering in silence. So let's get you to the right person. So yes, it might be an OB, a gynae. It might be a psychologist. It might be a sound healing bath. It might be saying, look, you're overworked and overwhelmed and you're exhausted. We need to give you some time off work.
Yeah.
And let's review. And that's the key. Review. We might not get the answer in the first week or 2 weeks. I'm not going to, or even longer. And that's okay. But we're going to be putting things in to make life easier for you. And then we'll get to the diagnostics. So please, I would say I've seen people saying, look, is there a group on offer for an ADHD diagnosis? Genuinely.
Are there?
Or I don't know, and I don't even.
You know, honestly, I don't think so.
Like, I don't think so. I hope not.
Yeah, I hope not. I wouldn't go for that group on. Personally,
and don't gift it to anyone either.
Yeah, don't gift it. Merry Christmas. It's terrible.
I'd get probably 5 of those in my inbox. In all seriousness, go to a recommended clinic. Go somewhere where it's not a one-hit wonder. You meet someone once and that's it. You've got ADHD. It is a neurodevelopmental issue. It's going to take time. You're going to have to talk to mum and dad. What was I like as a kid? Oh, I don't remember. You're amazing. Okay. Go through school reports. Genuinely make notes about how your mood, how your brain, thinking, cognition, memory is affected during your cycle, if you still have a cycle. And very quickly, mind, body, soul, spirit. So yes, the lifestyle recommendations are really important. Looking at gut health is really important. Looking at how your work is impacting you or the stresses at home are impacting you. Medication, very quickly. Medication, yes, there are medications for ADHD in particular, but when we're looking at perimenopause and ADHD, it is possible to look at HRT. Now, this is very controversial. I know some people... it's always been a controversial topic, hasn't it? HRT. But HRT is not just to help with the hot sweats and other physical symptoms. Like I said, estrogen is the scaffolding that's been keeping things together. If we can replace that estrogen, sometimes we find that is enough to minimize the symptoms. So it's not like something, I don't have ADHD anymore. Yeah, you've probably had it all your life. But we've got that scaffolding back. For women who have ADHD already, remember there is that group, and I'm sorry we haven't focused on that group, and they found that their medication isn't working enough. And rather than just upping the dose, saying, all right, you need to make an informed decision to say, shall we look at maybe having a little bit of HRT or a little bit of estrogen supplementation, which might keep you on the same dose. Again, that's a very personal decision. I'm not saying to anybody what they should or shouldn't do. You need to have that discussion with your doctor so you can make that choice.
And I would also stress there are doctors everywhere in the world, and in Dubai as well, who have that view. Like, I think a lot of people view going to a doctor like conveyor belt type. They saw me for 10 minutes and that was it.
Yeah.
Like that, there are many doctors in Dubai who are like you. Who look at a patient completely.
Absolutely.
So it's, please don't feel disheartened if you've been let down perhaps by healthcare in the past, whether it's here in your own country, because that's quite common to see.
Yeah.
And to just remember that there are doctors. So take referral from another doctor you trust, or like me, or from, a friend who's had a good experience or something like that, So I think that's really important to remember that, medicine we are like that. Like doctors are like this.
Yes.
It's not, if you've had a bad experience one time with a doctor who didn't even look at you when you came into the room, and that happens.
And I'm sorry about that.
Yeah, and I'm sorry about that too.
It's not. It does happen.
It does happen.
But I think, like we said, that our training has been different. We're very, very lucky that our training came at a time where the relationship is no longer, I'm the doctor, you're the patient. The way that I say it is, I'm your advisor, you're the boss. And so, which is true.
Yeah, you have to make the decision.
You have to make the decision, but I'm here to help you.
We'll guide you.
And we will guide you. Yeah. And I can kind of give you recommendations, but I'm going to give you everything and we will work on this together.
Yes.
That's it.
And also people are worried about budgeting and stuff. I'm like, well, we work within, like I have that with even the Botox, like, I have a budget for this. I'm like, that's fine. We work within that.
Of course.
So it's like, no doctor be like, no, you must have 20,000 dirhams worth of these tests done. No one's, people may be like that. But generally speaking, like a doctor of your experience and training, we don't behave like that, because it's like we do the tests that are appropriate for you, and that we think are going to be helpful.
Exactly.
And it's not some kind of a package deal.
No.
No, there's never a package like this is your ADHD perimenopause package. Like that doesn't happen.
That'd be lovely, though,
That would
wouldn't
be
it?
nice and
That would
easy.
be a Groupon voucher that you might want to buy.
That would make it a lot easier for everyone. But no, there is no
No.
such thing because everything has to be individualized to the patient.
Absolutely.
So, and you do need to take the time to have that long, extended consultation. And it's not a 5-minute appointment while you're on a Zoom call. Like it's going to be something a little bit longer.
Is she going to be listening to this? Sorry.
I feel really bad. It was absolutely fine. I get it. I totally get it. But yeah, so I think it's important to realize that for anyone who's feeling these type of symptoms and isn't sure where to start, find that doctor who will take the time and will go on the journey with you.
Yeah.
And there are doctors like that, like Dr. Kiren here in Dubai, that will go on that journey with you. So yeah.
Oh, thank
All right.
you. You're welcome.
Well, thanks so much for this podcast.
Thank you very
Thank you
much
for
for asking
joining.
me to come.
That was an excellent topic. I think a lot of people will find that very helpful.
Oh, brilliant.
So very good. So thank you all for joining and listening today. Please like and subscribe, and we'll see you again next week for the next Dubai Doctors podcast. Thank you.